Hi, my name is Vince, and in this presentation, I'll be conducting a media review on the chosen article titled Stimulus Package. Brain stimulation holds huge promise, but is critically underregulated, published by The Conversation in 2019, relates to the topic of neuroscience. This article makes claims about the rapid advancements in neuroscience regarding neurotechnologies aimed at influencing emotions, in turn aiding in addiction recovery. To review this article, I'll be using a specific framework known as the CARS framework, which is an acronym that stands for credibility, accuracy, reasonableness, and support. This framework is a tool that helps differentiate the quality of information that is being presented. This is important as it helps to ensure factual accuracy of claims, whilst also encouraging individuals to enhance their own critical evaluation skills in assessing information. I'll be using the indicators for or the indicators against each of the criteria shown. The first criteria of the CARS framework is for credibility, which refers to the expertise of the authors who are making these claims. It impacts the quality of information and checking various aspects of the author's credentials, including their educational backgrounds, research and peer-reviewed publications, helps in determining if they have relevant expertise. So the indicators for credibility that I'll include: author has relevant credentials and expertise, as well as evidence of peer-reviewed processes. I'll also be using lack of expertise. So Dr. Adrian Carr is a senior research fellow at the Monash University, who has an extensive background in areas of neuroscience and psychological sciences, and this is evident in his Monash University profile. On his Scopus author profile, it states that he has published 190 journal articles with a total of 3,060 citations, with publications in 36 areas. And he's also been awarded 3 grants in the following. The next author, Dr. Jamie Wolvich, whose expertise fall under the intersection of mental health and criminal law, encompassing legal research, policy development, and teaching various aspects of law, as seen on his profile on the Conversation website. On his Scopus profile, it shows that he has published 12 peer-reviewed journal articles with 36 citations, mostly in mental health disorders in the legal and criminal contexts. From this, his expertise do not quite meet the criteria of credibility in neuroscience. However, his expertise in law gives him credibility to talk on ethics and regulatory implications. The last author of this article is Patrick Haylock, who is a recent honours graduate who is practicing as a provisional psychologist. And on his profile on the University of Melbourne, it states that he has research experience in motor neuron disease, addiction, and mindfulness, with a current focus on neurotechnologies for sight restoration. In highlighting his expertise in psychology and neuroscience. However, I was not able to locate his publication history, which raises questions about his expertise in the field of neuroscience. The Conversation, the publishing website, is a non-for-profit journalism project that collaborates with academics to push articles on new research and also clarifies current news issues. Conversation has a high quality control process seen in their editorial policies that emphasize accuracy, transparency, and fairness. In Section 3, accuracy, sourcing, and attribution of the global editorial guidelines ensures fact-checking and sourcing is accurate and reputable. It also has a retraction policy that can be found in Section 10, which discusses the removal of information that is not true, violates copyright, or if internal procedures were not followed. The credibility score that I've determined is high in credibility. Due to a few uncertainties, I have scored the credibility 3 out of 5. The second criteria is accuracy, which ensures that information is timely, precise, and comprehensive. It ensures that the facts and statistics provided are current and reliable, and this reduces the chances of bias and misinformation. The indicators for I will focus on include timeliness, and details match those in primary sources. And the indicators against accuracy include older publication dates and limited coverage or incomplete picture. The sources used in this article are current and up to date. Majority of them are primary sources from within the last 6 years. So the first claim is that a patient known as Mr. Yan has become a medical pioneer as he has agreed to have electrodes surgically inserted into his brain. allowing his emotions to be controlled via a tablet to help him beat his methamphetamine addiction. And then, as cited on the ABC News website, China conducting world's first trial of brain implants to treat drug addiction confirms that Mr. Yan was the first patient to undergo experimental deep brain stimulation surgery for addiction treatment, affirming his pioneer status. Another claim made states that electrically stimulating the brain to treat addiction is a very new and unproven technique, which is supported by the article Deep Brain Stimulation for the Treatment of Drug Addiction. This states numerous animal studies have shown promising results in reducing drug-seeking behavior with deep brain stimulation, but the effectiveness of this technique in humans remains uncertain. Another claim is that tremors associated with Parkinson's disease with electrodes placed on the brain is common practice, and this is supported by the Shake It Up Australia Foundation's website, where it says that deep brain stimulation lessens motor symptoms like stiffness, slowness, and tremors in those with Parkinson's disease. Another claim is that deep brain stimulation involves a potential treatment for various conditions from anorexia nervosa to obsessive compulsive disorder. And this is also supported by the article Subcallosal Cingulate Deep Brain Stimulation for Treatment Refractory Anorexia. This study reveals that deep brain stimulation initially used for movement disorders like Parkinson's disease has been extended to neuropsychiatric disorders such as major depression, OCD, Tourette syndrome, and Alzheimer's disease. The claims regarding the risks associated with transcranial direct stimulation devices align with the provided sources. The article Regulating Consumer Use of Transcranial Direct Current Stimulation Devices discusses risks such as itching, burning sensations, negative mood changes, and potential impairments in cognition and memory. As the article accurately describes the details in the primary sources, it did, however, use sources that were from 2011 and 2012, which is significantly outdated. And because of this, I have scored the accuracy of this article 4 out of 5. Reasonableness. This criteria describes the information being presented, ensuring that it is objective, unbiased, logically sound, and has taken into account multiple perspectives. And this is crucial as it ensures for balanced and unbiased information, promotes critical thinking and informed decision-making. So the indicators for fairness that I'll be focusing on include objectivity and internal consistency. I believe that the article shows high fairness by addressing multiple viewpoints regarding the benefits and risks of brain stimulation. It discusses both the positive aspects of advancements as well as the concerns of underregulation. So for instance, it highlights how neuroscientific innovations are increasingly being integrated into medical practice and their potential applications beyond treating medical conditions. So for example, how electrodes are being used to treat tremors associated with Parkinson's disease, as well as how they could treat conditions from anorexia to obsessive compulsive disorder. The language this article used is neutral and objective, presenting factual information without emotive language or bias. For example, the article talks about potential enhancements of mental abilities through neuroscience without overstating the benefits or minimizing the risks. And then additionally, the article maintains internal consistency with logically connected ideas supported throughout it. For instance, it discusses initiatives for responsible neurointervention, demonstrating cohesive structure in its discussion. I believe that the article demonstrates high reasonableness with high levels of objectivity and internal consistency. However, it does lack indicators against this criteria. It does not appear to have exaggerated or distorted article claims. It doesn't show any bias, and it covers both the concerns about underregulation and the potential benefits. So for this, I've scored reasonableness 5 out of 5. And the last criteria for the CARS framework is support. This ensures verifiability of the information and that reputable sources have been used. This is important as without reliable sources, the quality and reliability of the article is uncertain. And I'll be using the indicators for support, including supporting evidence and acknowledgement of primary sources, and the indicators against the support include lack supporting evidence and cannot be corroborated. The article relies on a variety of sources, including primary sources from peer-reviewed journal articles, including the Journal of Neurosurgery, Science Direct, the National Library of Medicine, the Lancet Neurology, and the Medical Journal of Australia. It also uses a few secondary sources, such as ABC News, the Shake It Up Australia Foundation, and the Australian Brain Alliance. The article contains reputable sources primarily from 2007 onwards, with some dating back to 2011 and 2013. However, there are a few citations without accessible links, notably from the ARC Centre of Integrative Brain Function and an apparent conference that's hosted annually by Monash University and the ARC. The indicators for are reputable sources, primarily from 2017 onwards, with some dating back to 2011 and 2013. There are a few citations without accessible web addresses, in turn reducing the score of support to 4 out of 5. In conclusion, using the CARS framework to evaluate the credibility, accuracy, and reasonableness and support of this media review, I've determined that the article is well researched and contains a balanced perspective on the advancements in neuroscience and the associated ethical, regulatory, and societal implications. While the article holds high credibility, accuracy, and reasonableness, and is supported by reputable sources, there are a few improvements. This includes the inaccessibility of a couple of links within the article, and I think it could have benefited more from a more in-depth discussion about brain stimulation. So I've scored the overall media article 16 out of 20. And here are my references.